Before we begin, please know that some episodes include language that may be sensitive for some people. Thank you for joining me for another episode of The Birth Portal. My name is Connie. Today's true story is about a couple having their second baby. Mom wanted a home birth, but Dad wasn't comfortable with a home birth just in case something went wrong. Research, however, is very clear that home birth is just as safe as a hospital birth, providing the pregnancy has been healthy and normal, and there are no previous risk factors like a postpartum hemorrhage. The home is within a reasonable distance to the hospital if transport is needed. The weather conditions are favorable, and you have a registered midwife with all of their equipment, and her backup midwife or second attendant is available. This mom I'll call Robin had her husband paged to say contractions have started and are every 2 to 3 minutes apart. I ask, has her water broke? Does she have any urge to push? He says no. So I say, if you still want a hospital birth, head in there now and I'll meet you there. Robin's first labor was about 5 hours, which is pretty fast for a first-time mom. So I suspect this will also be a fast labor, likely half the length of the first one, as that's typically what we see second time around. Trying to get a person with contractions every 2 to 3 minutes out of the house or the apartment into a car, from the parking lot to the hospital onto the labor and delivery unit can have very different timelines. However, unknowingly to me, Robin and her husband beat me to the hospital. They make their way from the elevators down the hall towards the labor and delivery when Robin suddenly needs to use the bathroom halfway down the hall. I am driving as quickly as I can, calling the hospital to let them know we're on our way with a multip, which is someone who's had a previous birth, and she is in well-established labor. The nurses where I worked were amazing, and that if you suspected a possible precipitous birth, they would have the medication drawn up, the delivery tray ready, available to help in whatever way necessary. In my head, I'm going through her history and possibilities as I drive to the hospital. Once I get off the elevators and begin to walk down a separate corridor to get my hospital scrubs on, I hear a faint, "Nurse! Nurse!" I take another few steps and something stops me. I don't know what it was. I hear a third call for a nurse, all in about a matter of 5 seconds. And I think, could it be? Is this my client's husband calling out? I immediately turn back towards the labor and delivery unit, quickening my pace. As soon as I turn the corner towards the labor and delivery unit, I see halfway down the hall the profile of my client's husband, partially outside the bathroom, about 20 feet from the labor and delivery. I run to them and look to see Mum sitting on the toilet with eyes wide open, and she says, "My water just broke and I feel pressure." Just then, the labor and delivery doors open, and out comes a team of people. One of them is an OB resident with a package of sterile gloves she's opening on her way. I say, "This is my client," and grab her gloves. I quickly put the gloves on and let Robin know I'm going to reach between her legs and check her. I feel the top of the baby's head beginning to emerge and say out loud enough for the team standing behind me to hear. I feel the baby's head as I look into Mom's eyes. Mom has a look of panic, and I gently say, "It's okay, Robin. Everything is happening fast, but you're doing amazing." She's hit with another contraction, and the primal grunt begins. I have my hands cupping the baby's head and feel it coming. I say firmly but calmly, "Stand up now, Robin," and she instantly does with the help of her husband. The baby's head is born, and very quickly the body follows, landing safely in my arms. "Now sit down, Robin, and here's your beautiful baby." Someone hands me a warm blanket to cover the baby and dry it off as it cries, indicating to us all, "I'm okay, my heart and lungs are working." Dad is now laughing with joy and says to his wife, "You're incredible, babe. I guess we should have stayed home to have the baby." A nurse asks me if I want her to have the oxytocin. Robin is aware that this is given after the birth from a discussion had during a clinic visit. So I say yes and warn Robin what's about to happen. Oxytocin is the hormone our body naturally produces that causes contractions. It is given by an injection in the woman's thigh or through an IV line, depending on the situation. The purpose the oxytocin is given after delivery of a baby is to reduce the likelihood of a postpartum hemorrhage and shorten the third stage of delivery. The first stage is the labor. The second stage is the pushing and delivery of the baby. The third stage is after the birth until the time the placenta is delivered. Robin had a very fast labor and birth. We call this a precipitous labor and birth, which is a risk factor for a postpartum hemorrhage. The uterus can almost be like in a state of shock and fail to contract. Then, where the placenta was attached to the uterus can bleed profusely. Robin is holding her baby with the cord still attached. After a couple of minutes, a bed is wheeled to the door of the bathroom. Towels are placed on the floor, and we help Robin while holding her newborn to the bed, covering them with warm blankets, and wheel them to a room on the labor and delivery unit. Once in the room, Dad gets to cut the cord, grinning from ear to ear, and the placenta thankfully comes quickly and easily. Mom doesn't need any stitches, so we sit her up and baby is ready to go to the breast. Such a beautiful sight to see. Thank you for joining me for another episode of The Birth Portal.